this week at the University of Toledo Medical Center with Dr. Mallory Williams. And we're going to talk about something today, Doctor, that might be uncomfortable for people to talk about, but that's why we'll do it. Hernias.
Yes, sir.
When is the point when the symptoms might be developing where I feel like this is my time that I got to go to a doctor and get it checked out?
Well, most individuals are going to notice a bulge, and they'll notice the bulge down in the groin area, right where their crease, their inguinal crease is, in the lower part of their abdominal wall. They will ignore it invariably.
Sure.
Some people will even push it back in and it'll come back out. But at the point that they begin to have constant pain or tugging or warmth in the area, those symptoms usually mean that the hernia is progressing or enlarging in size. That's the point that they usually will present to me, the surgeon, or their primary care doctor, complaining of that discomfort in the inguinal area.
And certainly it's something that's going to be uncomfortable for people to talk about because that's a sensitive area for people. When you go through the process, I guess the one thing people will worry about is, what are the long-term effects? So when you talk to them, what do you walk them through? Where are the long-term issues?
Well, the first thing I try to do is to put them at ease. A hernia is a relatively common problem.
Okay.
Second thing I try to do is to explain to them exactly what this is. The abdominal wall is composed of muscles, and at some point those muscles thin out in certain people, and then there is a bulge or protrusion through those muscles. It's an area of weakness or an abdominal wall defect. Once they understand the problem, they get more comfortable with how we fix it. Usually, these things can be fixed either laparoscopically or they can be fixed through very small inguinal incisions. At the point in time the incision is made, usually a piece of mesh is placed right over the defect, and the patient recovers very soon after and is back to full activity.
Okay. Do you have any kind of reasons when you look into it? Is there any reason why it starts to flare up when it does?
Generally, it will begin as a small defect and a bulge. In certain patients, it will begin to increase and enlarge. What we know is that the fascial weakening, or the weakening of the abdominal wall there, is indeed growing or extending, okay. And the symptoms then will correlate and increase. Okay.
Is there anything people can do to prevent the onset of a hernia happening?
Well, we know that being fit and being strong in certain senses will not prevent hernia formation. In fact, most of hernia formation is due to congenital problems, meaning that you were born with these inherent weaknesses in your abdominal wall.
Okay. So people, if it's something that just kind of grows with them, then do you find that they're a little bit more comfortable talking about it if there's been some family history of it?
There's usually a family history, and that usually will prompt people to talk about it when you go into that family history and ask them, well, what did your father or your brother do when they had this occur? And they usually will describe the procedure that patient will also need. And
the procedures, from what you're describing, it seems like they've kind of advanced further so that it's not necessarily as painful, but at least it's workable for you.
Absolutely. It's a smaller procedure that's well done, usually as an outpatient.
Okay, all right. So it's okay to talk about it. With
absolutely.
Doctors and a guy like Dr. Mallory Williams here at UTMC. Thanks very much for your time, Doctor. We appreciate it. And that's your Talk Back.